the scars are not mini, and it's going to cost you more money to get to the result that you're looking for. Why I cannot stand mini treatments. The last reason why I'm not a big fan of mini facelifts is it's really just a marketing gimmick. Why I cannot stand mini treatments, because they're a marketing scam, and I'm going to tell you exactly why, from a facial plastic surgeon, why mini treatments should just be, they're done. We're never going to do them again, and I don't want you doing them. If you like this type of content, don't forget to like, subscribe, follow. YouTube content for me is for you guys. It's for educational purposes. I hope this helps you. So mini treatments, specifically mini facelifts, have a lot of problems. And I'm going to tell you who is a candidate for a facelift, why minis are bad, and what you should look for when you see this type of thing. So a face and neck lift, for those of you who don't know, treats the lower face and neck. So it's not your whole head. It is from about your mid-cheek area down to your neck. Most people think the facelift is the full face, and it really isn't. There are lots of surgeons that will do all the surgeries together, the eyelids, the brow lifts, and they may have a certain term for that entire package. But for the most part, a face and neck lift is a mid-face down to the neck. And in order to achieve a result that is natural, that is long-lasting, that looks contoured and looks, normal along your jawline, generally the accepted form for that treatment is a deep plane face and neck lift. That is where the ligaments themselves that tether the face down are cut so that things move very smoothly across the neck and jawline, where there's less tension, less pulled look. Not everyone needs a deep plane facelift, but a deep plane facelift, in my experience, speaking to colleagues, operating on patients, and seeing patients that have not had deep plane facelifts, tend to be the most natural looking, longest lasting, and having the best result. And those are deep plane face and neck lifts. Because remember, the neck muscle, the platysma muscle, starts at your collarbone and ends about here. So it's all treated at the same time. That procedure lasts a few hours in the operating room and takes 2 to 3 weeks to recover from. But that generally has incisions that are hidden around your ears and behind into your hairline. Now, mini facelifts evolved because surgeons had realized that there are ways to do procedures in the office under a little bit of sedation, or maybe no sedation, purely under local anesthesia, and get a similar result. But there are problems. Let's start with the first one. The first problem is the long-lasting portion of it. When the skin is lifted and small sutures are put into that muscle, those sutures are not necessarily going to create that long-term contoured result because the ligaments are left in place. Now, there are something called a SMAS lift, not to complicate it, but that is a modified version of that, where the skin is lifted and sutures are put in to tighten the underlying musculature. And that can create a nice result. But a mini facelift doesn't always address all the portions of the face and neck. It might address a small portion of the face without going into the neck. And one major issue with that result is something called a sweep deformity. It's a deformity where the face looks treated and has a swept look and the neck looks not treated, or vice versa. It basically creates a demarcation between an area that's treated and an area that's not. And mini might sound really nice, right? It sounds like you don't need something maximal. It sounds less invasive. It sounds less risky. But you got to think about what you're actually looking for. Are you looking for that ultimate result? Are you looking for a good result that's going to last you a long time? I don't think anybody can argue with most patients wanting that ultimate result. But realistically, is a mini facelift going to get you there? No, it's just not going to. The second thing that I don't like about mini facelifts is that the scars are not mini. They are maximal facelift scars with mini results. They still go around the same areas, around the ear and the back of the ear, sometimes still under the chin. But the tension now is also transmitted to the skin. Because things aren't released, you have tension in the areas of the skin, which can cause more scarring. I've seen pretty bad scars from patients that have had mini facelifts, and my patients who I do deep plane facelifts on, their scars don't look bad because there's not tension on that skin. We take all that tension off. So I caution you when you're thinking about mini procedures, maybe leaving less of a scar and you not requiring it. The last reason why I'm not a big fan of mini facelifts is it's really just a marketing gimmick. patients are sort of led down this path to make them think that mini is better and that it's going to result in a faster recovery, a great result, and something that's going to last. I think if you were to poll probably all patients that had mini facelifts, a large percentage, in my opinion, would say that they regretted the procedure if those patients had additional long-term procedures like deep plane facelifts in the future. Because ultimately what you want to remember is this is your face. So anytime you're opening up a plane of tissue to operate on, you are going to create scar tissue in there. And then it's going to be harder the next time. And it's going to cost you more money to get to the result that you're looking for. I've seen mini facelifts that create tons of scar tissue, that damage nerves. And remember, a lot of patients also have had minimally invasive treatments that create scar tissue too. So you're just making it a lot harder for you to achieve that for that result. If you are tempted by a mini facelift, which I understand, what I would say is save your money, save your time, save the downtime that you would take, and just wait for the proper facelift. A facelift is a facelift is a facelift. There's no shortcuts when it comes to surgery in general, nor should there be shortcuts when it comes to cosmetic surgery. As surgeons, we want to minimize your scarring, we want to minimize your downtime. All of our efforts should be geared towards giving you the best result though. We shouldn't be trying to compromise your result to give you less downtime. The safety and your result is the ultimate concern that we have. So who's a candidate for a face and neck lift? Generally, people who have laxity in the neck and jawline are the best candidates for a face and neck lift. That can include some laxity in the mid portion of the face, but it generally includes people with jowls and laxity in the neck. It could be turkey neck or fullness in the neck. And those patients probably had stronger, more defined jawlines previously, or maybe they didn't, but they definitely had some bit of laxity. Those patients can be tempted in different ways to choose whether it's a non-surgical treatment, a mini lift, a face and neck lift, a facelift on its own. And you will see most facial plastic or board certified facial plastic surgeons are performing deep plane face and neck lifts every single day, and those tend to give the best results. So in short, skip the mini facelift, skip the mini anything. I want what's best for you. I want you to get the best result, and I don't want you trying to cut corners because it might give you a few less days of downtime. If you like this type of content, don't forget to like, subscribe, and follow, and I'll see you next time.